Hello, my name is Alison. I'm the current chair of JRCALC, and I've been the chair of the post-Manchester Arena inquiry task and finish group on analgesia. I'm also an emergency medicine consultant and a pre-hospital clinician.
Hello, I'm Dave Rovardi. I am the Specialist Medicines Advisor to the College of Paramedics, and I'm also a Specialist Practitioner for East Midlands Ambulance Service. I've been part of the analgesic task and finish group for the Manchester Arena report, and also been part of the development group of the fentanyl monographs. So as part of the monographs, we've introduced oral transmucosal fentanyl, intranasal fentanyl, and also fentanyl by parenteral routes, which will mainly be for the ambulance service, intravenous and intraosseous.
For years and years, we haven't really had adequate analgesic options for severe pain, particularly for children. And this was to expand the analgesic options within JRCALC. This is all in line with the Manchester Arena inquiry outcomes, which showed that there had been inadequate pain relief, particularly for children in the early stages of a major incident. However, currently, fentanyl cannot be used by paramedics and anyone who's not a doctor because of the legislation. And until a group authority is issued, which is hopefully going to be in the near future, and organisations have procured fentanyl, we won't be able to progress this further. This is hopefully going to be in the near future, and the guidelines have been produced in order to prepare services and clinicians for safe implementation and administration to patients once these conditions have been met legally.
We're hoping by introducing a second opioid option into clinical practice that this will enable much more efficient use of analgesia for a much wider range of patients. Of two of the routes suggested, the oral transmucosal and the intranasal route, this will get around the issue of patients either unable to cannulate or can't cannulate in a sufficient amount of time to provide adequate analgesia. So we're hoping this is going to make a big impact on areas that, one, Alison's already mentioned about paediatrics, but secondly also in elderly patients where sometimes cannulation is extremely difficult. It will also reduce the delay in the introduction of analgesia because administration by the oral transmucosal and intranasal routes will be administered much quicker versus cannulating a patient.
I think it's also worth saying that fentanyl's been used in all its forms in hospitals for years and is a safe and effective, strong analgesic option, which we are now moving into the hands of pre-hospital clinicians, particularly paramedics. And it also addresses the issues around the time to administration of adequate analgesia for patients involved in major incidents and mass casualty events. So it covers a number of areas that we've been looking for another option that could be applied to all age groups for paramedics across the UK.